Miss Priscilla. I'm going to be your student nurse today. I'm going to be performing an assessment on your head and neck, okay?
Okay, that's
Alright, so we're going to start off by looking at the head. So the head is an appropriate size for the body. It's symmetrical. There are no visible lumps. I'm going to go ahead and palpate your skull, okay?
Okay, that's alright.
So let me go ahead and put on my gloves.
Okay, thank you.
Alright, so let me start palpating your skull. Alright, so from what I'm looking, there are no lesions or infestations. Let me know if you feel any tenderness.
No.
No tenderness? Okay. Alright, perfect. And then the head, it seems that there's no drooping, so that's great. Alright, so now I'm going to be testing your cranial nerve 7. So can you open your eyes and close them? Can you frown? Can you smile? Can you puff out your cheeks? Alright, perfect. So patient was able to do that. So her cranial nerve is intact. Okay, so I'm going to be testing your temporal artery bilaterally. Alright, and it seems like the pulses are +2. Now I'm going to be testing your cranial nerve 5. So can you bite down for me, please? Alright, and then I'm feeling the masseter muscle is firm. Perfect. Can you open your mouth against my resistance, please? Alright, perfect. So that cranial nerve is intact. Now I'm going to be looking at your temporomandibular joint. So can you bite down for me and then open up and close? Alright, so there is no grinding. Alright, perfect. So now I'm going to be testing the patency of your nerves. So can you cover one nostril for me, please, and then breathe out the other? Alright, and then vice versa. Alright, so it seems like both nostrils are, there are no obstructions and it's patent. Alright, so now I'm going to be checking for your sinuses, so the frontal and maxillary sinuses. So I'm going to be touching them and let me know if you feel any tenderness on them, okay?
Okay.
So let me touch right here. Feel any tenderness?
No.
Alright. And then right here. Any tenderness?
No.
Alright, perfect. Alright, Priscilla, so now can you close your eyes for me? I'm going to be giving you something to smell and then just let me know what it is, okay? I'm going to be testing the cranial nerve 1. Alright. So go ahead and smell.
Smells like vanilla.
Alright, perfect. So it is correct. The cranial nerve is intact. Alright, Priscilla, so now I'm going to be looking at your eyes, alright? So it seems that there's no swelling in the eyelid. Your eyes are symmetrical. The sclera is white and shiny. I'm going to be checking for your conjunctiva. Alright, so I'm going to be pulling down your eyelid and then you go ahead and look up for me. Alright, it's nice and pink. Let me try the other one. Alright, it's nice and pink as well. And your cornea is clear. There is no lesions or anything. Right, so alright, Priscilla, so now I'm going to be doing the cover test. So you're going to cover one eye for me and then you're going to look at a distant object that way and then I'll let you know when to uncover it, okay? So go ahead. And focus on an object at a distance. Now go ahead and uncover it. Alright, perfect. And then go ahead and do it on the other eye. Alright, now go ahead and uncover it. Alright, so there's no sign of strabismus. Okay, Priscilla, now I'm going to be checking for your cranial nerve 3, 4, and 6. Alright, so now I just want you to focus on my pen and I'm going to move it around. I'm going to do the 6 cardinals of gaze, alright? Alright, perfect. So there was no involuntary shaking of the eye. Alright, so now I'm going to be checking how reactive your pupils are to light. Alright, so I want you to focus on a distant object behind me and I'm going to flash a light on each of your eyes, okay? Alright, perfect. So your eyes and pupils constrict and are equal in size. Alright, and then now I'm going to be holding my pen up here and I want you to focus at a distant object behind me and then once I'm coming inward, focus on my pen, okay? Alright. Alright, so your eyes were able to cross. There was no involuntary shaking. Alright, so the cranial nerve 3, 4, and 6 are intact. All right, so based on this test, your pupils are around equal in size, reactive to light, and accommodate. So that checks off Perla, okay? All right, Priscilla, I'm gonna be testing cranial nerve 2, which is your peripheral vision. So I want you to cover your eye and then focus on a distant object behind me. And I'm gonna put numbers on the bottom and on the top, and then you let me know what you see, okay?
Okay.
All right, so just focus on that distant object.
2, 3,
All right, and then go ahead and switch.
5, 1.
All right, perfect. All right, so that nerve is intact. All right. Okay, Priscilla, now to finish off cranial nerve 2, I'm going to be handing you the Snellen chart, and it's just going to be 14 inches away from your eyes. I have a tape measure here just to verify that it is 14 inches, and then I'm going to have you read the numbers on here from each of your eyes. And then just one quick question for you. Do you wear any glasses or have prescription on them?
But I have contacts on right now.
Okay, all right, perfect. So just stay with your contacts on. Hold it at 14 inches. Let's just measure. All right, so a little bit lower. Okay, there you go. That's perfect. All right, so now go ahead and read the first 3 numbers right here.
632.
All right, now go ahead and cover one eye and then read these numbers.
427.
Okay, now read these next 3 numbers with the other eye.
365.
All right, perfect. Thank you. So you started on those numbers. So that cranial nerve 2 is intact and in normal. Okay. All right, Priscilla, now I'm gonna be looking at your ears. So it seems that they're both equal in position. They're above the temporal lobe. They are symmetrical, equal in size, and shape. Okay, so they are both symmetrical, equal in size, and they are normal shape. So now I'm going to be palpating both of your ears. All right, so it seems like there are no nodules or tophi. And then I'm going to be palpating your mastoid and let me know if you feel any pain, all right?
Okay.
Pain? All right. So now I'm going to be palpating your tragus. All right, let me know if you feel any tenderness or pain.
No.
No pain. All right, perfect. Thank you. All right, Priscilla, now I'm going to be performing the test for cranial nerve 8. So I want you to cover one side of the ear, and then I'm going to whisper 2 words on this side, and then you let me know what you hear, okay? Dog, cat.
Dog, cat.
All right, perfect. And now I'm going to go to the other side. Balloon person.
Balloon person.
All right, perfect. So that cranial nerve is intact, and wow. All right, thank you. Okay, Priscilla, now I'm going to be inspecting your mouth. I'm going to be using a tongue blade to look around your mouth. From the outside, I can see that your lips are not chapped. There are no lesions on them. They are pink and they are moist. Okay. All right, Priscilla, now go ahead and open your mouth for me, and then I'm going to be looking at your gums. All right, so they are nice and pink. They are moist. I don't see any ulcers or lesions or any redness. So that's perfect. All right, Priscilla, now I'm going to be looking under your tongue. I'm going to put my tongue blade there, and I'm just going to be looking around under your tongue, okay?
Okay.
Go ahead and open your mouth for me. All right. And I don't see any redness or any sores. It's pink and moist. I can see your Wharton and Stenson's duck. Go ahead and put your tongue down for me. All right, perfect. All right, now go ahead and stick out your tongue for me again. Okay, so the tongue position is normal. There are no tremors on them. Okay, so go ahead and put your tongue back in and then open wide. I'm going to look at your teeth, okay? All right, go ahead and open. All right, so there are no cavities or any broken teeth. All teeth are normal. All right, thank you. Okay, Priscilla, now I'm going to put my tongue blade back in again, and I'm gonna be looking at your tonsils. All right, so go ahead and open your mouth wide and stick out your tongue for me, please. All right. Tonsils are pink. They're a grade of 2+ and seem normal with no lesions. Okay, perfect. All right, so I'm gonna be testing cranial nerve 12. All right, so I just want you to move your tongue side to side. All right, perfect, and then just up and down. All right, so the cranial nerve 12 is intact and it's normal. Okay, Priscilla, I'm gonna be looking at your hard and soft palate. So just open your mouth for me and look up. All right. All right, perfect. Both of them are normal. They are pink. There is no redness or swelling on them. All right, you can straighten your head now, and then go ahead and open your mouth and stick out your tongue for me, and I'm gonna be looking at your posterior pharyngeal wall. Okay. All right, I'm gonna stick my tongue blade in, and then just open wide. All right, postpharyngeal wall is pink. Moist, and there are no visible lesions on them, and there is no redness as well. Okay, Priscilla, I'm going to be looking at your uvula, so go ahead and open wide for me. All right, so uvula is midline, it's pink, there is no swelling on it. Okay, I'm going to be testing cranial nerve 9, so go ahead and open your mouth for me, stick out your tongue and say ah, and then I will be putting my tongue blade in just to look at your uvula. Okay? All right, perfect. So the uvula moves up and down. Now go ahead and open your mouth for me again. I'm just gonna test your gag reflex. All right, perfect. So both are intact, so that cranial nerve 9 is intact. All right, and from looking at you and from what you've been speaking to me, I can tell that cranial nerve 10 is intact. You're speaking normally, swallowing, there are no hoarseness in your voice, so cranial nerve 10 is intact. Okay, Priscilla, now I'm going to be looking at your trachea. Alright, so I want you to go ahead and put your head up for me. Alright, so from what I can see, your trachea is midline, there's no swelling or lesions. Now I'm going to be palpating your trachea. Alright, so just let me know if you feel any tenderness or pain, okay? You feel any tenderness?
No.
Pain? Okay, perfect. Okay, and from what I can see and feeling from your trachea, there are no palpable lumps as well, and no visible ones. Okay, Priscilla, I'm going to be testing your cranial nerve 11 and range of motion. So can you move your head side to side? And then up and down. Alright, and I'm going to put my hands on your shoulder, and then you go ahead and shrug for me, okay? Perfect. And now I'm going to be putting my hands on your cheek and just go against my hand, okay? Alright, now I'm going to do it on your other cheek. Alright, perfect. So, that cranial nerve 11 is intact, and the range of motion is there. And she was able to do this with ease. So, she has a good range of motion, and that cranial nerve is intact. Okay, Priscilla, now I'm going to be palpating your lymph nodes. I'm going to be palpating around them, and then just let me know if you feel any tenderness or pain. I'll be asking you again during the palpation, okay?
Okay.
Alright, so I'm going to start with your pre-auricular. So I'm going to start right here. Do you feel any pain, any tenderness?
No.
Alright, now I'm going to your post-auricular. Alright, do you feel any pain or tenderness? Alright, perfect. I'm going to go to your occipital, here in the back. Alright, any pain or tenderness in there? Alright, so now I'm going to go to your tonsillar, right over here. Do you feel any pain, any tenderness? Okay, now I'm going to go to your submandibular, here. Do you feel any pain there, any tenderness? Alright, and then I'm going to go to your submental, right here. Any pain, any tenderness? Alright, okay, Priscilla. Now I'm going to be doing your anterior your cervical chain. So I'm going to be starting with one side of the neck and then going to the other, okay? And then let me know if you feel any tenderness.
No tenderness.
Okay. Feel any tenderness? Okay. So now I'm going to be doing your posterior cervical chain. So I'll be starting again on one side and then doing the other shortly after, okay?
No tenderness.
Right. Alright, now I'm going to be doing the other side. Tenderness. Alright, perfect. Okay. Alright, Priscilla, now lastly I'm going to be doing your subclavicular lymph nodes. So just go ahead and shrug for me and I'm going to put my fingers in there to palpate. Alright. Feel any tenderness or pain? Alright, perfect. Alright, so they all seem normal. Patient had no pain or tenderness. So your lymph nodes are normal.